Welcome to the Achieving Your Optimal Health webinar. And the reason you're looking at Las Vegas area trails is because all of our webinars are under the health education link of this site. And you just navigate to that health education link and you can see all the webinars we have created as a team since June 12th of 2019. And today's webinar is with Dr. Denise Tropea. And I think she gave one of the very first, the first webinars that we ever did back in June. It's so good to have you with the team, Denise. And and her webinar, you click on it, it's the disinfectant dilemma, the disinfection dilemma, selecting the best hand sanitizers, antimicrobial. Okay, let me try this again. Selecting the best hand sanitizers, antimicrobial soaps, and antiseptics. So, fortunately, Denise, our expert, will be able to pronounce all of these and tell you about them a lot more than me. Denise is one of these unique people that has bridged Western medicine as a podiatrist for most of her career, and then bridged that into natural medicine, where she is now practicing natural medicine, and she'll be telling you about some of her most recent projects in addition to this webinar. But for now, we're going to focus on the hand sanitizers and how to select from the confusing array of hand sanitizers. So you're going to learn how to distinguish various hand sanitizers, antimicrobial soaps, and antiseptics by name, how to decipher the technical terms that are used on the labels, how to determine the situations for which each type of product is best suited. Believe it or not, hand sanitizer is not just hand sanitizer, but each type of hand sanitizer has a different specialty and different use. Denise will help us with that. The ingredients in the various products and the effects these ingredients have on our skin. And perhaps some are not healthy. Some are more healthy than others. Denise will help us to sort that out. How to compare alcohol-based versus non-alcohol-based hand sanitizers, and whether washing with soap and water is still the best option. That's going to be interesting. I'll have some questions on that area. So by the time we're through with this webinar, you're going to have the ability to face a supermarket shelf full of various hand sanitizer, antimicrobial soaps, and antiseptics and make the best choice for your needs. You're going to understand the power of the good bacteria present in and on our bodies for our protection against pathogens. And you're going to know how hand washing with soap and water and the action of rubbing your hands will indeed reduce the bacterial count and help prevent the spread of infection. So yeah, hand sanitizers. At one point, it was like we had a famine of hand sanitizers. We couldn't find enough. We couldn't find any. And now all of a sudden we have more than we know what to do with. So Denise is going to help us to sort out the confusing array of hand sanitizers. And definitely you can read about her her background on this page of Las Vegas area trails, but just to underline, she's definitely well studied and experienced as a doctor, and then also as a natural medicine practitioner. So Denise, I want to turn this over to you. I'm going to unshare the screen. You can share it, and let's go for it. It's good to see you, Glenn.
Okay. All righty. So share screen. Okay. Share. Oh, Here we go.
Yay.
Wow.
Good job.
All right. All right, now we can do the slideshow. Here we go. We can do the slideshow too.
Awesome.
Isn't that great? Okay. All righty. So there we go. So we call it the disinfection dilemma. Okay. It's, when we think about disinfection, and there has just been, so much out there. What do? We need to clean the area. We need to make sure our hands are clean, make sure our surfaces are clean. I mean, just our phones are clean, the tables, the list goes on. Never before have people been so conscious about actually sanitizing and disinfecting. Now, being in the medical field for over 30 years, that's pretty much one of the mainstays to help prevent disease. I've been in the hospitals for years, my own office, clinics, and, disinfection, sanitizing, sterilization, it's all part of it. And also to know it properly. I've been a surgeon for many years, and when you go into surgery, you have to know what exactly is sterile and what is going to be utilized on the patient. You want to make sure that those instruments and supplies do not have any contamination, as we call it. Because when there is contamination, then the possibility of infection, a post-surgical infection, is very high. So, disinfection and, sanitizing, it goes much deeper, of course, when you're doing things like that. But I feel that at this point, it is just very important to talk about, just the basics. And, some of these things may be things that you already know. You may pick up some different, different tidbits along the way, but I'm going to kind of outline it. And then what I would like you to do is, ask questions, or at least you have this for a reference. And you can always get in touch with me if you want to learn more about certain products. So when we first talk about certain disinfecting products, we are talking about things such as hand sanitizer. What is disinfection? What is sterilization? So we want to classify these accordingly. With a hand sanitizer, you have a liquid, gel, or foam that's used to decrease the number of infectious agents, bacteria, viruses, fungus on the hands. And a sanitizer is ineffective if the alcohol concentration is too low. So anything below 60% may not be effective. We're seeing that hand sanitizers now can run anywhere between 75 and 95, well, maybe even like 65 or so, but in that range, in that ballpark. So a lot of them have gone to about 70%. A disinfection is the process of cleaning something with a chemical in order to destroy the bacteria, the viruses. Also, you can use heat, UV light, radiation. All these things can disinfect and destroy pathogens. Sterilization is a process, though, of making something totally free of microorganisms, such as when you utilize surgical instruments. It's called, I had an autoclave in my office, and that's what I did to surgically sterilize, my instruments, to sterilize them. And then you also have supplies that we purchase that can be sterile, such as gauze, and of course, needles. These are all very important in the medical field. So this way, infection is not carried over to the patient. Okay. So what are the situations where these agents would be most appropriate? Well, hand sanitizer, it's best when the soap and water is not readily available, but you need something in a pinch. but it should not be in place of. If you have an opportunity where you can wash those hands with soap and water, then by all means, do that. Disinfecting agents are usually applied to surfaces of inanimate objects, tables, chairs, computers, and it is a two-step process. First you want to clean up the area, then you want to spray that disinfectant, and the directions will explain for how long it should be on that surface before it's wiped off. When I am cleaning certain things in my kitchen, after I have, say, prepared some like raw chicken I had, and I have it on the counter, on a cutting board, countertop, then what I'm doing is I'm going to clean that area first, a soiled area, then I'm going to spray the disinfectant and let it sit there for however long it should, 5 minutes, 10 minutes. Then I can wipe it clean, and then I can use my multi-purpose cleaner that I've utilized. So with disinfectant, it does need a certain amount of time to be present in order for it to destroy the pathogens that may be there. And especially, we all know that with chicken, you can have like salmonella. Of course, with raw meat, you can have certain other bacteria, E. coli, for example. So you really need to disinfect those areas. And then when we talk about antiseptics, that is used in cases of minor cuts and scrapes on your skin. And you want to destroy the initial bacteria that's in an area. When a tissue gets damaged, the bacteria can get in. But if an antiseptic is used kind of right away, it can help reduce the amount of bacteria in that area. The gold standard in the medical field has been betadine, which is iodine, and that's been used for many, many years. And then hydrogen peroxide can also be used for wounds that need some cleaning. When you initially get a wound, a scrape with some dirt in the area. So those are your go-tos with the antiseptics. So with sanitizer and disinfection ingredients, let's talk a little bit about that. As I had said before, with a sanitizer, ethyl or isopropyl alcohol must be within the 60 to 95% range. 70% has been shown to kill coronavirus on surfaces, along with other viruses as well, but our main focus today is coronavirus. It's also a drying agent. Alcohol can be very drying, and it can irritate the skin and strip away the natural oils on our skin. The natural oils on our skin is a protection. And if our skin is too dry, it is going to start to crack, and that's when bacteria can get into a crack and could cause an infection. So you can rid the good bacteria on our skin, and it's an open invitation. Now, iodine, betadine, that's been used for many years to decrease the amount of bacteria on your skin. And it's typically used as a prep for procedures. If someone's going to have a procedure done on a certain part of their body, we scrub them down with the betadine in order to decrease the amount of bacteria. When people are allergic to iodine, we use something known as Hibiclens. And that's an alternative for people that are allergic, let's say, to iodine, or they have other sensitivities to their skin. So Hibiclens has been around for a long time as well, and you can purchase both of these over the counter. And all these types of ingredients do have a drying and irritating effect to the skin. So that's why it is important to keep down the amount of times that you're utilizing them, especially a hand sanitizer. If you're consistently using that, that could lead to, as I said, irritations. So with hand sanitizers, we can have those alcohol-based versus non-alcohol-based. Alcohol-based can be toxic, Alcohol can be a toxic thing, especially if you have a child that has had some alcohol-based hand sanitizer and then they start licking it, that could be a problem. And also, there has been found to have methanol in some of these sanitizers due to the fact that maybe they were running out of the ethyl or isopropyl alcohol companies and they were using methanol, and that's wood alcohol, and that's very, very toxic if it is ingested. So it will kill the germs, yes, but also it can do other damage. Now, if you have non-alcohol based, that can go into the realm of being non-toxic if it's not synthetic chemicals. So there's a little disclaimer there. Not all non-alcohol based are non-toxic because you just don't know what they are putting in there. That's why it's important to read the labels. They can put certain things such as sulfites and parabens, polypropyl, what is it? Yeah, polypropylene glycol, which is used in antifreeze. So, there are a lot of things that can be toxic as well if it's not alcohol based. But a true non-alcohol based natural type hand sanitizer, and I'll talk about some of that very shortly, will not strip away the natural oils because it does not have alcohol in it. It'll still kill germs, but once again, you have to read the label of what the active ingredient is. The majority of active ingredients in the non-alcohol based are oils, such as thymol is a derivative of thyme oil. And yes, that's an active ingredient in which it is a natural antiviral, antibacterial, antifungal. So natural-based sanitizers are your oils, such as eucalyptus. Eucalyptus is an unbelievable oil. It is typically a cure-all, antifungal, antibacterial, antiviral, used for many years. And then thyme, as I said before, the thymol, which is the derivative, tea tree oil, lemon. All these things can be utilized to make sanitizers homemade. And also, for example, lemon oil can be used as a disinfectant. You can use that and prepare that as an all-purpose cleaner. Even eucalyptus can be an all-purpose cleaner. And the EPA has approved thymol as a proven disinfectant against the COVID-19. So I've always been very fascinated with the power of oils. I utilize oils for cleaning. I utilize them with diffusing my environment, especially now with our environment, with the haze and the smoke. I do quite a bit of diffusing in my home to help our lungs, to help the breathing and the respiratory. Very, very helpful in that. So now we're going to go a little bit into soap and which soap is best, regular or the antibacterial. And studies have shown that antibacterial soap is no more effective than regular soap. But when you're a consumer, you think, well, let me get the antibacterial soap. It'll probably work better. Well, not necessarily, because you don't want to have, once again, too much destruction of your good bacteria. When we talk about good bacteria, we talk about the bacteria that's helpful in protecting your skin. We have many, many bacteria that's living on our skin, in our nose, in our mouth, esophagus, our stomach, etc. And it's all the good stuff. And if you're utilizing too much in the realm of hand sanitizers, antibacterial soap, you may be doing a little more harm than good. And regular soap will not kill the healthy bacteria. And also, I wanted to talk about this time about the chemical additive that's found in soaps and toothpastes and detergent, deodorant, tricycline. And that is something that, is still on the market. And many people are becoming more aware that this additive is something that can be linked to health issues such as cancer, hormone disruption. And so with this additive, we can, once again, look at the labels and decide, do we want to switch our products? Do we want to switch to soaps and toothpastes that do not have this in there? For myself, I utilize toothpaste without the sulfites in it, without the parabens, the more natural kinds. That's what I buy. Same thing with deodorants. I avoid deodorants with the aluminum and those other chemicals that can be harmful to us because we're constantly putting them on our bodies. Just think of how many times we've been using hand sanitizer for these months. As you can see, the shelves were just wiped out. And people were just constantly using hand sanitizer, thinking that, oh gosh, I don't want to get a virus. I don't want to get sick. Well, there's a certain amount of truth to that, but we have to realize that we must be aware that there's a time and a place for a hand sanitizer, time and a place that we wash our hands with soap and water, and hopefully stay healthy. So hand washing versus hand sanitizers. Well, nothing can replace a good hand washing. And I've always been a big fan of soap and water, soap and water. And when you wash your hands properly, but only 5% of the people do, it is a process. And I guess of all the years of doing surgery and having to do a 5-minute scrub on my hands and up to my elbows before you go into surgery, you really find that nothing beats just that friction, and rubbing and scrubbing in order to get that bacteria number down and also any type of pathogens off of your hands. Because 80% of communicable diseases are transferred by touch, meaning that you touch a surface, then you touch your hand, then you touch your mouth, and it gets, or your eyes, rub your eyes, and it gets contacted that way. And 30% of people do not use soap when washing their hands. I found that interesting as well. And what I had said before about good bacteria, and anywhere between 10,000 and 10 million bacterial species live on each hand. And that's not including your whole body too. And this is just, what we need to survive. It's all part of our immunity. It's our first line responders. And that's why we do have this good bacteria in order to keep us healthy in the environment around us. And then let's not forget, Global Hand Washing Day is October 15th, so it's right around the corner. So to summarize, we have options, okay? We can become smarter consumers of these agents. And I think limiting the use of hand sanitizers is important. And knowing, in a pinch, you need to use it. You carry one in your purse. They say don't keep it in your car, though, during very warm weather, like here in Las Vegas, because yes, it could be a problem because of the alcohol content. And hand washing to me is still the gold standard, and using soap, because the friction from rubbing your hands and the soap, which then will foam, will reduce that amount of germs on your hands. So, hand washing. I mean, I've done that, feels like forever. And as I teach my children over the years, they know as soon as they come into the house, what do? They wash their hands. Before we're ready to eat dinner, what do? Wash their hands. You know, it's just, I don't know, take out the garbage. What do you do when you come in? Go wash your hands. So it's just something that has to become second nature. And hopefully more, you know, more people will be aware of that. So I've always, you know, been interested in this. I think it's very important. And also what I think is important too, which could be a webinar for another day, is really all the chemicals that are in different products that we buy and how they can be very harmful to us. Not everyone, but it can be, depending if people are sensitive or not to it, such as what is in your makeup, what is in your deodorant, your shampoos, you know, things that you use day in and day out. And that's why over the years, I have gone to all natural based product line. And hopefully that will, you know, help me, you know, with my overall health. So I think that's all part of it. Once again, it's what you eat, what you think, what you drink, and what you put on your body is so important. So thank you very much for this webinar. I'm glad that I did this. And you can email me at behealthy2016@gmail.com. And my website, www.triplecrownscience.com. Sign up for our newsletter or email me with any questions you may have, whether it's on the website or tonight's webinar. With the Triple Crown, we bring the education. Education is brought out to the consumer, and we look at a lot of alternative health modalities, and we're continuing to grow with our research and bringing to the table the important alternative health modalities that are here today for us, because they're here. People have to just get educated on what is there for them, what are their special needs are, and how we can help them as well. So thank you very much.
Okay, Denise, that was very awesome. When you first mentioned, see, this was Denise's idea to do the webinar on hand sanitizers, saying,
Right.
what shall we have as our subject? Denise says hand sanitizers. My first thought was, oh, that's going to be boring. And hand sanitizers are something we take for granted. And yet you've opened up a whole new world as far as understanding hand sanitizers. And I really appreciate this. I've got a question. Is cheap harmful necessarily? Now I know soap, as you mentioned, and soap
Right.
is just regular soap, not antibacterial soap is what you're recommending. That certainly is inexpensive. But when you see hand sanitizers on the shelf, is it a dangerous approach to just say, oh, these are on sale, I'm going to get these?
Yes, I would say so. Once again, it's alcohol, and they can have some synthetic chemicals in it as well. And a lot of it can be very burning to the skin and cause a lot of irritation, because once again, it's the quality of what they're utilizing. I know they say Purell is probably one of the top, you know, products, and maybe it's because of them having the moisturizers in with it as well. And that could be helpful. But still, alcohol can be very irritating. It can be drying. And yes, it does kill germs, but it's also going to do other damage. That's why, I mean, to get something, you know, on sale, you know, in the long run may not be the best thing. Maybe just to use in a pinch here and there. But there are other alternatives, like I said, more of the natural based with the oils in them.
Yeah, sounds like you're really recommending natural oils rather
Yes,
than alcohol.
yes, absolutely.
Where do you find them? Are you going to find them at Smith's or Albertsons, or do you tend to need to go to a special place or online in order to
Well, you
find
can
hand?
go, you can go online. They have them like at Sprouts or Trader Joe's, Whole Foods. Then the vitamin stores have them. There are some very good names out there that do have the eucalyptus oil, the thymol in it, and I think it's probably those are the better ones to go with.
It sounds especially like if you're a parent with young children that you
Mhm.
really want to be careful, especially that what you said about the wood alcohol was
Yes.
a little frightening.
Yeah, that is very frightening because really the FDA, I really don't know where they're at with it, but they have made recommendations, please stay away from it, or whether they pulled it from the shelves. I think they have. They've pulled some hand sanitizers from the shelves, and because of what they've had in them. So it's really very concerning. Even regular hand sanitizer with children licking their hands with that can be
Mhm.
harmful as well because it's alcohol.
So, do you have any particular products that you recommend?
The a clean well is one of them that I've been buying. That's a good one. Myers soap is a good one. Mr. Bonner's soap. There's a few of them that are good. If anyone ever wants to just get in touch with me, I can talk to them about some of the different product lines that I have found um, to be very good. Because once again, even with moisturizers, toothpaste, I wind up using natural based products.
Okay. Yeah, yeah. You made me want to run to the drug cabinet in my bathroom and pull out the toothpaste to see if it had that try whatever
Oh
that
yeah, the
you.
tricycline. Well, there is one toothpaste company that still puts it in their toothpaste, and
Hmm.
the rest have pulled it. But I'm also using natural based toothpaste these days as well. Uh,
Maybe just putting some baking soda on your toothbrush.
no, no, I buy ones with the essential oils in them. I like that.
Hmm.
It's very good. Uh, with the toothpaste, so the natural ones. Mhm. I think that could also be another webinar is just to talk about all the
Definitely.
ingredients because years ago, early 2000s is when I started with different natural skincare companies.
Hmm.
And I was also a consultant for one for many years. And um, I would be doing the research on a lot of these products and what they have in them, and even in baby products. And that is not good either. People are becoming more aware now that things that we were using in the past can be problemsome, and now we have to start making that switch.
Well, it seems like it is lately, the last few months have taught us that it's a matter of life and death
Mhm.
to sanitize your hands,
Yes.
to wash them, or if you're like you say, you're out in public, and you don't have access to soap and water, to have something with you so that when you're touching things that um, you can sanitize your hands
Hmm.
safely without harming them, and and definitely not touch your face, and it sounds like that is what you said about most germs being spread by touch, um,
Yes.
is really instructive.
Yes. Most are. most viruses can be, you know, by touch, by the doorknobs and the desks and computers. I mean, even around my home, you know, I've made what do I do maybe every week or so is I go around there and I wash down all that with the natural disinfectant that I have, with eucalyptus and thyme, you know, and that's what I do. I clean down everything. And once again, you have to let it sit there for a while, you know, and let it soak in order to get disinfected.
Now that was really instructive.
Mhm.
You know, I had not thought about letting the disinfectant sit. And I'm sure that there are a whole lot of people that just knew that naturally, but that
Well, no,
was
so, you
a
know what,
new one for me.
some people don't. Some people don't. I mean, when I had my office at the end of the day, it was just like disinfecting everything that you name it, we disinfected it. And everything was sprayed down and everything was, and you know, back then, I made sure we wore gloves and our masks because we were utilizing different types of disinfectants that could be harmful. And we're doing that because we want to kill some pretty bad, you know, bacteria. So we would make sure. And that's another thing that I maybe didn't hit upon is like Lysol and a lot of those sprays. Yes, they will kill the viruses and the bacteria, but they're also very irritating to your respiratory system.
Mm.
So you have to be very, you know, careful of that.
So maybe you wouldn't use an aerosol disinfectant?
I tend to stay away from them. I use more of a spray, like not an aerosol, but a spray
Little
when I'm
pump
going to
sprayer?
disinfect down things. Yes, uh-huh. Yeah.
Okay.
Yeah.
And
Sometimes with the Lysol, we would do like the toilets with them, you know, and then, you know, flood them down and then leave the
mhm,
bathroom and put the fan on, you know,
mhm.
whatever. But yeah, I would do more of the spray versus an aerosol.
Wow. And that's kind of interesting because the disinfectants like Lysol and some of the others are, you know, they've got fragrances in them that they're very pleasant. And so you're thinking, oh, this smells good. This room smells clean. And as you're saying those things and thinking those things, you're inhaling that into your
Mhm.
respiratory system. You know, that's another thing I hadn't thought of, but it's just becoming
Yeah,
clear.
yeah, yeah. Got to be careful. Got to be careful of that.
Mm.
Yeah.
Now, okay, I've got a question a little off topic, not entirely though. You mentioned toothpaste, and I'm wondering if you've ever heard of ionic toothbrushes.
Yes, I've heard of them. Yeah.
Give me your read on them. I know that it's really big in Japan. They have a brand called Soliday, and then here in the United States, there are other brands, but the idea is that it has an electrical charge to it that reverses the electrical charge that is holding you know, bacteria to your teeth and holding
Mhm.
tartar to your teeth and helps to release that, and you don't even need to use toothpaste if you use an
Mhm.
ionic toothbrush. So what is your read on all
Yes, yes, I think it has some validity to it because instead of doing the scrubbing action from the toothpaste and having that interact with the bacteria,
that?
then what you're doing with the ionic, it's just another way of getting rid of the bacteria. So yes, they do work. It can be a little more effective because it is there's so many minutes that it is in each area.
Mhm.
So you're timing it so it's more uniform than people that are just scrubbing, you know, uh, randomly. And much like what I spoke about before, is that you can disinfect by using radiation, UV light,
Mhm.
radiation, heat, all that can also be utilized to destroy the germs.
So what kinds of disinfectant do you recommend? If I'm just looking for a disinfectant.
Yeah, well, I think the 7th generation products are very good. They have them in Sprouts. I believe some of the supermarkets have that as well, maybe even Albertsons. But 7th generation is really a good name to utilize. And then in Trader Joe's, they have their multi-purpose cleaner, which I like because it has all the oils in it. That's good for just, general countertop cleaning. But I would say those are usually my go-tos.
At one time, it was really big to use enzymes and cleaners that had enzymes in them that would eat away the bacteria. Had you ever heard of that?
No, not particularly, no.
I know there was when I lived in Connecticut, there was a multi-level marketing company that marketed enzyme cleaners. And you'd spray the enzyme cleaner on and you'd let it sit, and then the enzymes would eat the
The bacteria.
grease and bacteria and everything you didn't want on the surface.
Well, like I said, there's so much, yes, there's so much out there. You have to really just read those labels and get those products and try them out and see how you like them. Go from there. But like again, once the hand sanitizers, I think we can, be more aware of how devastating all that alcohol can be on our skin.
Yeah. Well, before 6 or 7 months ago, the term hand sanitizer wasn't really even in my vocabulary.
No. And like I said, I wasn't a big fan. I've never been a big fan of them. Like even after you wash your hands, you don't have to use a hand sanitizer. You've washed your hands, they're clean. So, you're good there. You don't have to. But it seems like even in the hospitals and wherever we go, hand sanitizers are just all over the place. And,
Well, I think this is very instructive in the age of COVID-19, especially, and going into flu season, and just realizing that this could be the barrier against really becoming ill, horribly ill at this point, and we don't have a vaccine yet. So this is basically this and a mask are basically all that we have at this point.
Yes, sure. And then everything else you can do to help, boost your immune system as well.
Yes.
That's very, very helpful, doing it from the inside out and, but yeah, we really just have to be cognizant of that.
So what's your favorite immunity product? You had mentioned something about immunity early on in the webinar, and you just kind of passed through that because you were talking about hand sanitizers, but you had mentioned something to the effect that you had experienced some real benefit from some immunity product.
Yes, the immunity product is the Immurogen, it's called, and it is a supplement that is all your proteins, your DNA proteins actually, and it helps to rebuild your DNA, and it's also helping to repair it. And what it's doing is helping to regenerate your cells. It's helping especially your gut lining. And when it's helping your gut lining, it's helping the immunity. It's helping to repair your DNA. Then your immunity is really beginning to ramp up. And this is where it all has to be at. We need to strengthen that immune system in order for us to be healthy during these unprecedented times.
Can you say the name of that again? Maybe spell it. I missed it.
Oh, it's IMU, IMUREGEN, Immurogen.
Immurogen. Where do you
Yeah,
get it?
it's been in Europe for over 70 years.
Wow.
And it came here in this country about 1 year ago from the Philippines. And um, it's just an unbelievable supplement in which it goes right to that DNA level. And it's a liquid or capsules, or they have little tablets that you can throw into water, like 16.9 ounces of bottled water. And it's just, I'm just amazed every time I learn more and more about it, how it really does help the body just bring it back into balance. And I've just seen so many studies that have been done on where it can really make a difference.
Immurogen. Okay.
Yeah, Immurogen, it's called, yeah. And this is where it's at now for our overall health is going right down to that cellular level, because we need our cells to be properly replicated. If they're not properly replicated, then you're still going to get replication with the same amount of errors, and that's leading to a bunch of cells that can be very damaging. And the more damaged our cells are, that's what leads to disease.
Okay, so now we're talking about um, cleansing from the inside out.
Oh, absolutely, yeah. And that's important too. Much like what we put on our skin, much like what we put, yeah, very important.
Now, you mentioned something else that I'd like to pursue, just since we're getting close to the end, but we've got a little time left. You mentioned diet, and I'd like to ask you, what is the top 3 suggestions to transform your diet to make you more healthy? And I'm going to preface this by the thought that a lot of people are going to a keto diet because carbohydrates turn into sugar in your system, and that converts to fat, harmful sugar and fat. Sugar is poison. Get sugar out of your diet. So no grains, no sugar, and they have what they call a keto diet. So let me ask you, in light of all the things that are out there and all the packaged diet programs that are out there, Nutrisystem and just so many, South Beach, Jenny Craig, you buy the meals. How do you make sense of that? And I'll just go back to the original question. What are your top 3 suggestions if someone wants to make 3 changes in their diet? They're going to create the most significant health impact.
Well, number 1 would be anti-inflammatory foods. You Google anti-inflammatory foods, and a lot of that would come up as your, vegetables, like beets and greens and, all of that. Also, eliminating dairy. I think milk can be very inflammatory. So if you can eliminate dairy and see how you feel after that, that may be a big help.
It's like milk, cheese, all dairy products. Okay.
Yeah, dairy, and there are other alternatives you can utilize, like oat milk or maybe almond milk. If you still, want a milk base, which is what I utilize. with that. And last but not least is your water, utilizing quality water. If you want the water to be a little alkaline, that's okay too. But really drinking more water and eliminating the sugar. So if there were three things that I would say would be the most important, that would be it. Sugar is probably the most devastating problem, is what it's doing to our bodies. No, not so much, becoming a diabetic, but just so many other things. So that really needs to be addressed in our diets.
So if you're using the correct hand sanitizer, but you're eating a lot of sugar, you're kind of working against yourself, aren't
You're kind of
you?
working against you. Yeah, yeah. So I think, the first step is with a diet. I was never one to follow diets, but I think it's just so necessary to make a diary of really what you do eat
Mm,
and what you do drink,
mhm,
and then look back and say, okay, well, maybe I shouldn't have, those, couple of sodas a day, or
mhm.
maybe I shouldn't be having that fruit juice, or maybe I should dilute the fruit juice. And then eventually, more water, bring in more water. Or what about herbal teas that are unsweetened? That can be very helpful. Doing things with the herbs and antioxidants in that respect.
Okay, so that idea of the diary got me to thinking, because
Mm.
if you make a diary of the things you're eating, you'd want to have like the date, the basically what I ate this week. But there's another element on there that I think is really important. I'd like to ask you about that. You'd want to have some kind of way to track your symptoms, how you're feeling. What would you want to be tracking? Like, okay, I cut sugar out. Am I, what am I tracking? Am I tracking my energy level? Am I tracking my brain fog, perhaps? Am I tracking my joint issues?
Mhm.
Yeah, what are you tracking? What kinds of things are you looking at in your body to really know if it's making an effect?
Well, I think just what you were saying, because if you eliminate your sugar, or you're slowly eliminating it rather than go cold turkey, you're going to feel that, I do have more energy, or I do not have that brain fog. Um, that, or I'm not craving more and more sugar. And the same thing with the dairy.
Mhm.
Could be that if that's so inflammatory, that could be aggravating. Say it's aggravating your sinuses, say it's
Mm.
aggravating the joints. So with that diary, you can have a little place at the bottom to talk about certain symptoms that
Mhm.
you may be feeling or not feeling. And then as you track that, it can really show you that, by me eliminating these foods, I'm feeling better. I'm not feeling as bloated. I'm not feeling, lethargic, all that.
Yeah, I've always been one for
Yeah.
just being a real expert on your own health and
Mhm.
analyzing, what you're doing, different, exercise, diet, supplements, and just analyzing, how is this affecting my health? Analyzing, I'm a distance runner. And so
Mhm.
I get to analyze a whole lot of injuries and back engineer and figure out, okay, what caused this heel injury? What caused this knee injury? And, was it the shoes? Was it what I'm eating? My diet? Was it the type of workouts that I'm
Mhm.
doing? But I think almost that it's so important to be an expert at reading your body and reading your own health. So anyways, thought I'd throw that out when you mentioned diary. It really struck a
Well,
note.
that's where it's all about, is really to be aware and to be connected. Once again, it's the connection and things that we've been talking about ever since we started this over a year ago. And we've brought so much of that to the table in many different topics.
Mhm. Well, Denise, I want to thank you for what you shared, and it's really evident. I can ask you questions like this off the cuff because your well of knowledge is so deep that it's like nothing stumps you because you have thought about so many different areas and issues and that is truly valuable to people.
Thank
So
you.